We're going to talk about nosocomial infections. Some examples of nosocomial infections are MRSA, VRE, C. diff, CRE. So we're going to touch on a little bit of those today. The first thing I like to talk about is MRSA. So when you think about MRSA, remember it is a type of bacteria that is resistant to several antibiotics. And so what happens is over time people used antibiotics that maybe didn't necessarily need it, and so this bacteria has built up a resistance to several types of antibiotics. There's two types of MRSA. There's one that is called healthcare acquired MRSA. This is what you see most often in hospitalized patients or people that live in institutions. Or we have something that we like to call community-acquired MRSA. And so community-acquired MRSA, typically those occur in healthy individuals that are not hospitalized. Typically that population consists of people in school or maybe in prisons or in college housing. They're very close together where they could potentially use each other's personal items. So remember with MRSA, it is spread by direct contact. So you as a healthcare provider, you must use contact precautions when you are taking care of this patient. To diagnose MRSA, we do two things. If we think they're just a carrier per se, then what we will do, we can do nasal swabs. And that lets us know if they have MRSA, or we can actually, wherever the lesion might be, we can do a culture of it, send it in. It takes about 48 hours for us to get the results back, and then that will let us know that they have MRSA. So when you're talking about MRSA, realize that there are people at a higher risk of developing it. So some of the people that are a higher risk for developing MRSA are older adults. There's multiple reasons there, but just realize one of the main reasons is they're more likely to be hospitalized, and they also have an immune system that doesn't function as well as when they were younger, because remember, your immune system is at its peak performance in your 20s and 30s. So that's one reason why our older adults are more at risk. Also, people that have multiple invasive lines and or tubes, so hospitalized patients, they are at a greater risk for developing MRSA for the simple fact that they tend to have more invasive lines than just the general population. Also, just people that have impaired immune response. And then people that have a long-standing history of antibiotic therapy. Because remember, MRSA is a bacteria that has gotten smarter, and so it's become resistant to lots of antibiotics. However, while these are the people that are a higher risk, remember, anybody can develop an MRSA infection. So when you look at your symptoms of MRSA, typically it starts at a site where there's non-intact skin, such as an incision or an abrasion or some type of sore. When it starts off with, it kind of looks like one of these. It looks like just a swollen, painful little bump. Some people might confuse it with a spider bite or think it's just a pimple. However, it's not. So when you see these types of things, especially this one that looks like it has pus in it, you do not squeeze it. A lot of people, they like to squeeze things, but not these. Okay, the best thing to do is just leave them alone. Also, besides just looking very red and irritated, it could be warm to the touch. It could have fluid. The person could also have a fever along with this. So the reason we worry about MRSA, it can cause infections in the bone, in the joints, in the valves, and in the lungs. So if we don't catch it in time, it's going to progress, and it's going to become a systemic infection, and then it's much harder to treat. So when you're looking at your treatment options, some things you need to remember. One, typically, especially at this one I showed you right here, these smaller ones, they start like this, but they progressively get bigger. And so a lot of times what we will do is we will do an IND of the abscess, because we've got to get out that infection. And sometimes that's the best thing to do, is to get out that infection. And then we're also going to put them on antibiotics. I've listed 3 antibiotics that currently are what we use for an MRSA infection. Remember, with an MRSA infection, the main issue is it's resistant to a lot of antibiotics. So currently this is what we have to treat MRSA infections. You've probably have seen these in the hospital setting. The other thing is, when we're taking care of these patients, we want to make sure that they're on contact isolation. So they need to be in a private room when they're hospitalized. Also, you want to minimize the time they're outside that room. If they have to leave for an ultrasound or some type of test, then wherever the infection is, we want to make sure that area is covered, because we don't want to potentially expose other individuals if they were to touch that area with wherever that wound is and it wasn't covered properly, that type of thing. Also, remember that we want to make sure that they have their own items. So when you put someone on contact isolation, remember, your stuff you don't want to bring in that room. So you want to make sure in that room that they have their own thermometer, their own blood pressure cuff, all of that, and so you're not bringing it in there. The other thing you want to make sure and do is, in a contact isolation, you don't want to bring any of your own in there. So for example, your pen, or you don't want to bring your clipboard, because those are potential surfaces that the MRSA can get on, and it could potentially be carried to other patients. So we just want to really make sure that that's clear. Also, contact isolation, I know it's been a little while since some of y'all have gone over PPE, so I put this link up here that talks to you about donning and doffing, which is a nice term for saying putting on and taking off PPE. So you need to make sure and watch this. This is something you're going to do quite frequently in practice, and also that's testable material. So make sure that you know how to properly put it on and properly take it off. So I always like to talk about, what do you focus on when you're educating people? So one of the biggest things you can do is just talk about the need for good overall hygiene. You want to stress the importance of hand washing. Also, that they need to hand wash adequately and for a long enough period of time. So you want to make sure you educate on all that. Also, you want to talk to the people about that have the MRSA, or the people helping take care of this individual, that they need to avoid close contact. Okay, because remember, wherever that wound site is, that could potentially infect someone else. So we want to keep wherever the area is covered. We don't want people messing with the infectious wounds, especially if they're not wearing gloves and they're not following standard protocols. Okay? Also, we talked to them about not sharing personal items. So what I mean by personal items, washcloths, soaps, towels, clothes, razors, things of that nature. We don't really want to share any of that, because we want to try and prevent an MRSA infection. And one of the biggest things is, if there is a sore that's present, please educate people about not popping it or picking it, just to keep it covered and see what happens. If it gets worse in a couple of days, then that warrants a visit to the doctor to see what's going on. But they don't need to be popping it and mashing it, because think about it. It's encapsulated right now, but when they pop it or they mash it, then it becomes, it starts to spread. Okay, and so that's one thing we really want to be careful about when we're educating people. So that's MRSA. Another very common hospital-acquired infection these days, especially, is VRE. So VRE is vancomycin resistant. So what this is actually a strain of bacteria that lives in the intestinal tract, and it often becomes resistant to vancomycin. This was first identified in 1986. It was found in Europe. And then what happened was, they found it occurred in patients in the hospital setting. This is an opportunistic infection, and we see a lot of this. We have about 20,000 Americans every year that develop VRE. So the thing you have to realize is, some of the risk factors for developing this: prolonged hospitalization, also a severe injury or abdominal surgery, because think about it, it's a bacteria that lives in the intestinal tract. Also, people that are immunocompromised are more at risk for developing VRE. So the thing you need to realize is, the symptoms are going to really be dependent on what all's going on with them. So typically what you'll see GI symptoms. They will start showing symptoms of a UTI. They can develop skin lesions, and they'll also start developing a fever and chills. So those are some of your signs and symptoms you're going to see in someone who has VRE. So if someone has VRE, they need to be on contact precautions. So go back to contact precautions when I talked about it on the last slide, so you will be aware what these are, because you're going to do the same thing in someone who has VRE. So the scary thing about VRE is that this bacteria can actually live from days to weeks on any surface, and it can still cause an infection. So it's really, really important that we clean any type of contaminated surfaces very well with whatever the hospital recommends, so that we are not transmitting this to other patients. Again, hygiene is a must. So you need to make sure that you're educating the patient. You need to make sure you're educating the patient family members, and then you need to make sure that you follow your standard precautions, because we don't want to carry this from patient to patient. CRE, this is actually a newer one that's come up in recent years. But what happens is this bacteria is resistant to antibiotics. Okay, so the antibiotics they're resistant to, the reason this is such an issue is because those antibiotics, that is our last line of defense to treat multi-drug resistant bacterial infections. Okay, so what that means for this patient to develop CRE, guys, we don't have a lot of medications to treat it. Because everything we use to treat MRSA, to treat VRE, well, you know what? It doesn't work with CRE because it's resistant to all of those. So that is why there is a very high rate of deaths from patients that get CRE. So the biggest thing we can do is prevent them from getting CRE. Now, when you look at risk factors, typically it's your patients that are hospitalized and they're immunocompromised. Those are your risk factors for developing CRE. So what you need to make sure and do, if a patient comes back and they are positive for CRE, they are on strict contact precautions. Now, I posted a little YouTube right here that's really neat about CRE, and it will talk to you about some of the risk factors. It'll talk about why we're so concerned with CRE and what it means for us in healthcare right now. So please take some time to watch the CRE video. Another one I always like to talk about that you're going to come in contact with very frequently is C. diff. So remember, C. diff, it is a bacteria that is normally found in the bowel. What happens is sometimes it can develop into an infection because we have reduced the normal flora or the good bacteria in the bowel through the use of antibiotics. Because remember, most of our people that are hospitalized, they are on lots of antibiotics. So just realize that. Some of the risk factors for developing C. diff, typically this occurs in your patients 65 years and older. And please make sure I just said typically. It can definitely occur in someone younger than that, but usually the population we see it in is 65 or older. Also, recent hospitalizations make them more at risk for developing C. diff. If the person has a weakened immune system, or if they ever had any type of previous infection with C. diff, that just puts them at a higher risk for developing this. C. diff, the things that it causes major stomach pain and cramping, and this individual has massive explosive diarrhea sometimes, depending on where they're at in their journey as far as C. diff. And so when I mean it has a very strong odor, C. diff has a very distinct odor. Typically, once you smell C. diff, you will be able to recognize that when you go into another patient's room that has that exact same issue. It is that strong, and it is that distinct of a smell. So realize that, again, if someone is on C. diff, then what we're going to do for them is we're going to, if they're on antibiotic, we're going to discontinue their current antibiotic, and we're going to change them up, and we'll put them on some different types of antibiotic. Typically, we put people on vancomycin. Okay? The other thing we're going to do is, remember, they're going to be on contact precautions, because C. diff can spread person through contaminated equipment. Okay. So that's one thing we're going to do. Another thing that we're going to do, and actually has been very successful, is fecal transplantations. This is really neat. Your book goes into a little bit more detail about this, but this has actually been very successful in treating C. diff. So the scary thing about C. diff is hand sanitizer, it's not effective in killing this. So I know oftentimes in hospitals they talk about foam in, foam out. And yes, you should always do that, but just realize with C. diff that the hand sanitizer is not effective. So you want to make sure with C. diff that you wash your hands with soap and water. Okay? And so that's what's going to help the prevention of C. diff more than anything else. So while I'm talking about all these infections, I always like to touch on types of precautions you're going to use. You have a great chart in your book. It's called Transmission-Based Precautions, and it's in the chapter where it's care of patients with infections. You are responsible for knowing the different types of precautions, what you wear for airborne precautions versus droplet precautions versus contact precautions. That is something you'll be doing often in your healthcare career, so you have to know the difference, and you have to know how to effectively put it on and take it off. I give you some examples of when you would use these type of precautions, but that chart is really good and it goes into just a little bit more detail, and so make sure that you watch that video.